Good morning. My name's James Stanger. I'm an embryologist of 50 years experience, and this fertility IVF Daily Short Takes is designed to produce a quick summary of critical issues that affect the fertility industry and may be of value both to IVF staff and to their clients. Today's short take is called Human Fertility at Crossroads, and it's a summary of an article published in Reproductive Biomedicine Online by Bart Fowler and co-authors. So you can read along if you like. This is my summary of the paper. The critical thing is around about the 1970s, there were about 3 billion people living on the planet. It is expected that way before the end of this century, it will plateau at around about 10 billion people in a global population that will be reached, followed by a short decrease afterwards. And you can look at this graph in the paper, and you can see how they're anticipating that that's where we are now, 2025. It will rise to a huge number with this plateau, with some fall, but the fall is very marginal. This review of population trends in relation to fertility in the last century, and it doesn't make for good reading, I'm afraid. So the authors start off by saying that in order for population in a given territory or region to remain stable, the total fertility rate, the TFR, defined as the number of children born per woman in a lifetime, should remain around about 2.1 per woman. Due to the success of strategies promoting the slowing down of world population growth, along with multiple changes in society that will be addressed later, the number of countries below replacement level is rapidly growing. The mean total fertility rate for most OECD countries stands at 1.5. Today, more than 50% of all countries worldwide are well below replacement level, and this is expected to increase to over 90% of all countries by the end of the century. A shrinking natural population size triggers fundamental societal changes, and governments, along with international organisations, are slowly beginning to realise that challenges associated with underpopulation can no longer be ignored. The most prominent society repercussions of underpopulation appear to be the following. First, there are short-term benefits to society because fewer children are being born, and therefore societal costs associated with schooling and higher education are lower. Secondly, fewer young people will be available to take care of older family members, resulting in a massive increase to the cost of elderly in society. Third, there will be a reversal in the ratio between young and elderly people on one hand and the working population on the other. And finally, companies in many countries are complaining there are not enough young people to fill vacant positions. This will affect their present international competitive position along with future growth. Understanding the reproductive trends and needs of individuals in modern society needs to be reviewed. Clearly, fewer and fewer children are being born in developed countries, as established in many detailed national and international reports. The reasons could include 1, a changing position of women in society. For the last 75 years, more and more women have engaged in full employment outside the home. Ironically, they are still expected to work equally to men and do the housework that men do not want to do at home. Secondly, postponement of childbearing age. The average age of women giving birth to their first child is above 30 in the majority of European countries. Unsurprisingly, the age of first birth is even higher in women with higher education. The natural fertility of women decreases on average from 30 years onwards due to diminishing ovarian reserve. In practical terms, the postponement of childbearing beyond 35 reduces the chance of becoming pregnant without medical intervention to at least half, whereas on average fertility would reduce to less than 20% above 40 and close to zero at the age of 45. Thirdly, the stay-at-home generation. Today's young adults are slow to move out of home, mostly due to financial reasons. As such, the progress of relationships and desire to establish a family may be substantially delayed and might not happen at all, resulting in loss of opportunities to contemplate family building. The rate of voluntary childlessness at present, data showing that an increasing number of individuals are opting not to have children. The underlying reasons for this choice may vary amongst individuals and cultures and may include concerns about the current geopolitical state of the world related to climate change, presumed overpopulation, or difficulty in affording having children. The lack of any or the right partner to start a family with, aiming for a pregnancy without success, or simply the willingness to maintain one's current lifestyle. Fifthly, there is insufficient access to affordable fertility therapies. And this is one of the areas that the authors spend a lot of time looking at. Worldwide, about 1 in 6 infertile couples will seek medical care to establish a family. So that even though IVF is actually surging around the world, it represents only 15% of the potential demand. It's quite unfathomable and quite scary. Unfortunately, safe and effective treatment remains out of reach for most couples worldwide due to a lack of health insurance coverage or the associated costs. Low affordability when patients have to pay out of pocket for treatment, or starting with national differences in legislation, as shown between different European countries. Wider world access to assisted reproduction would help to reduce the burden of infertility and advance reproductive health and justice. For the above-mentioned reasons, the number of medically assisted production, what they call MAR, but really it's basically IVF. But MAR includes things like natural ovulation cycles or insemination cycles, as well as IVF, some surgery. But IVF basically is the starting and end point of all surgery. The number of medically assisted cycles per million inhabitants varies widely between 60 and 5,000 from one country to another. Yes, accordingly, a great variation in the proportion of children born following MAR has increased from 0.2% to up to 10% of all natural births can be observed. I'm not quite sure that 10% is correct. Increasing demand for fertility care interventions. Finally, an emerging reproductive need on the part of single men and women, along with members of the LGBTO community, can also be observed. Hence, infertility treatment under these conditions are also referred as fertility care. Increasingly applied in circumstances not related to fertility, but to society's change. For instance, in the UK, surrogacy arrangements, half of those are for gay men. In addition, the demand for non-medical social egg freezing is increasing, allowing women to buy time regarding decisions to build a family. So the authors finally finish up by saying, if you want to promote family business, it's not about advising women to have more children, but merely about reducing barriers or facilitating women who wish to start a family. Undoubtedly, the right of women to decide not to have children should be acknowledged and respected. And in addition, it should be emphasised that decisions about whether or not to establish a family are not only an issue for women. Hence, partners should be actively involved in such decisions and take related responsibility. This is a fairly complicated paper, but both clinic staff and IVF clients should be able to read it, and it's important to understand how fertility clinics are trying to desperately adjust to changing societal needs, and the access of disadvantaged groups, non-infertile couples, are increasingly starting to have major impacts on fertility services. Thank you.